Hey, it's Peter with Physical Therapy TV. In today's video, we're going to discuss left shoulder pain. You might be experiencing, pain in your left shoulder or maybe even your right shoulder, and you're wondering why. Why do you get pain in one shoulder? There are quite a few reasons. In general terms, I'm going to discuss just a couple with you, but you always want to seek professional advice with your doctor or a specialist in terms of identifying exactly what it is and the diagnosis of your pain. But could be overuse. You might have hurt yourself working out in the gym, maybe doing a lot of overhead presses, or maybe incorrect technique on a bench press, or lifting a weight overhead. Could be anything. Could even be just general activities. Working a lot in front of your body or overhead. I've seen in my time quite a few of overuse injuries like painting, for example, or repetitive lifting. So that could be one cause of your left shoulder pain. Another very valid reason for shoulder pain could be trauma. You might have fallen, landed on the one side of your arm, strained some ligaments and some muscle tendons, and as a result you have pain. Could be a rotator cuff weakness. Many times due to just general atrophy and weakness in the shoulder joint. Rotator cuff muscles are the main muscles responsible for keeping your shoulder healthy. When they get weak, you can develop pain due to arthritis, impingement, bursitis, even a tendonitis. Lastly is poor shoulder position. This is a hidden cause of left shoulder pain and very, very common, and something not a lot of doctors really think about talking to their patients about and addressing, and that's your shoulder position. What kind of activities are you doing during the day? What are you doing on a repetitive basis? We're in a society today where we sit so much and we work forward slumped so much that it jams our arms into our shoulder sockets, and it causes a whole host of problems, including impingement, tendonitis injuries, chronic inflammation conditions such as tendonitis and bursitis, and this could be one of the major reasons for your shoulder pain. One of the best ways to alleviate this is to improve the positions that you are on a daily basis and incorporate stretching. Your symptoms might be pain. Your pain might be located primarily on the top and in front of your shoulder. Sometimes you can have pain. Some of your other symptoms might include weakness, popping in the shoulder, inability to sleep. Each of these symptoms can indicate a different shoulder pain problem, including tendonitis, impingement, a rotator cuff tear. So it's very important that you get an accurate diagnosis. So just to quickly give you an idea, typically if you have rotator cuff tendonitis, you'll be able to move your shoulder freely in all directions, but it is painful. Typically it's very tender on the side of the shoulder joint and in the front when you press on it. Also, the rotator cuff tear, you're going to have limited ability to reach up overhead or behind your back, and you're going to have pain on the side of the shoulder. If you have bursitis or adhesive capsulitis, or also known as frozen shoulder, you're going to have a loss of range of motion, but you're not going to have a rotator cuff tear, but you're going to have extreme pain lifting the arm out to the side of your body or overhead. Treatment for shoulder pain would obviously be to first get an accurate diagnosis from a doctor. Once that's been determined, you can plan how to treat your shoulder pain. Obviously, you first want to end the irritation that's causing the pain. Ice and rest is usually the second thing you want to do. You might need a cortisone injection or some anti-inflammatory medicines, which be the third and fourth steps, and you get this from your doctor as he feels it's appropriate. And then lastly, very, very important, probably could have put this on the first list, because you got to stretch and strengthen your shoulder in the correct way. Some of my favorite shoulder exercises, once it's indicated and your shoulder irritation and inflammation is brought down to an appropriate level, is to do some bilateral external rotation with an elastic band, shoulder blade squeezes, and a doorway stretch. Doorway stretch is great for that forward slumped posture, gets that shoulder in a good position. so that the muscles and tendons can work efficiently. Got a free report for you over at theshoulderreport.com. It's just some free information and some helpful hints to help alleviate your shoulder pain. Thank you so much for watching this video, and we'll speak to you soon.